So today we'll be discussing C-DIFF, which is actually an infectious illness. It's a gastrointestinal infectious illness. It is called pseudomembranous colitis because it is an inflammation of the gastrointestinal tract due to specific bacteria called C-DIFF for short, but it's actually called Clostridium difficile. So that's why it's called C-DIFF. It's just short for Clostridium difficile. And it affects your gastrointestinal tract. How that happens is when a patient is on too many antibiotics, it kills off the good flora, leaving the Clostridium difficile to go into an overgrowth, causing inflammation in your gastrointestinal tract. We'll look at the chain of infection. The infectious agent is the Clostridium difficile. The reservoir is the colon. It lives and spreads in the large intestine. The portal of exit is actually feces. A sign or symptom will be explosive diarrhea. And when that happens, the spores are how we have transmission, because the spores contaminate surfaces like bedpans, floors. If you're thinking about even if someone were mopping, it could get on the handle. It can just, you'd be surprised how things can get everywhere. So then we look at the portal of entry, and the portal of entry is consumption. Sometimes the Clostridium difficile, the C-DIFF, can live on things like raw vegetables or raw fruit. So that's why hand washing is really preventative, and washing all of your fruits and vegetables is really, really important, especially when you're promoting a healthy diet with your residents. You want to make sure that you do a lot of preventative care, like washing. So a host can actually be a young person, especially can be an elderly resident, because they tend to take antibiotics for things like UTIs. So when you build up this resistance to the antibiotic, and it kills off the good flora, and there is this overgrowth, you think about how many times your elders have to take antibiotics for various reasons. So that it can really, they are more susceptible to being hosts. If you think about any patient that has to be on antibiotics, this can happen to them. It is also nosocomial, which means that it is something that happens in hospitals. So it can spread through spores on contaminated surfaces in hospitals. And how that happens, when we want to look over here at precautions, the only thing that works against it is bleach and water. It's a solution of bleach and water. It's the only thing that can kill it once it is made its portal of exit and it has infected a surface or a person. So you really, really want to use preventative equipment. We'll discuss what that is in a moment. Hand sanitizer does not work. So if you want to be preventative, you absolutely have to wash your hands, clean all surfaces. I know we all like to use a lot of wonderful cleaning products, but the only thing that's going to help against C-DIFF at the end of the day is if you really do that last pass, or use sterile precautions of bleach and water against C-DIFF. If someone were to have C-DIFF, they would have to go into isolation, and we will look at the effects of isolation in a moment. But first, let's look at preventative, what we want to use, like our PPE. So we want to use gloves, and we of course want to use a gown, but we're definitely going to have to be using goggles, because there is, we will look at the signs and symptoms, but one of the symptoms is diarrhea, and you want to look at like splash effects. So you want to have all of your preventative care. I would even take it a step further and wear a hairnet. And that's why it's so important, not just that we wash our hands, but always have our hair up. Because as awesome as and proud as we are of our hair, and things can splash, and it's just the best standard precaution. There are sterile precautions like isolation and your gloves and your gowns, but also looking at standard precautions too. So let's look at some of the signs and symptoms. If your resident does have C-DIFF, there will be abdominal pain or cramps. If you see someone like kind of bent over, like, oh, it hurts right here, and it's in the abdominal area. There will be watery diarrhea involved, you know. There will, unfortunately, can be sometimes bloody stools. There will be a fever. And as a result of watery stools, bloody stools, there will be dehydration. This is really important. We should always battle diarrhea no matter what the causation is. Always remember, please, to give electrolytes. It's also very, very helpful to our residents to put those fluids back in. Let's urge, they'll have an urge, our residents will have an urge, our patients will have an urge to have a bowel movement. It'll be uncomfortable. They might need to go more than once and try. The first time they might not go, the next time might be watery. It just will be very uncomfortable. There could be spasms involved. And because of all this water loss and you're not really keeping food down, there's a loss of an appetite, and it results in weight loss. So also what we want to look at are the effects of isolation. There can be a fear with our patients or residents of neglect. There could be a fear of being an infectious person and not getting, you know, the care that you need. So we really, really need to reassure our patients what protocol is, that we're only following protocol, and just be as friendly and as compassionate as we can be with our care. We also want to provide stimulation, because there could be a lack of stimulation being all alone in a room that's closed off. And one of the most important is visitor education. We really, really want to educate our visitors on what the policy is, how our particular facility is going to be handling C-DIFF, what the isolation procedures are going to be, what our standard precautions are going to be according to our facility, and of course sterile precautions. You know, if your gloves get dirty, please change them. Please, you know, see the proper facility protocol on how you should put on your gown, when you should put on your gown outside of the room, and you know what the goggles, you know, what particular goggles the facility is going to want. And that is a look at C-DIFF.